Go.
Hello everyone, I want to welcome you to this short video. My name is Dr. Dirango KM. I'm a consultant physician. I'm also a fellow of diabetes, doing a course in diabetes with University of South Wales. So today I want us to look at one of the complications that we do not talk about enough of diabetes, and this is a condition known as diabetes gastroparesis. So diabetes has several complications, and the way we look at them is we divide them into two at first. There are those that we call acute complications, and there are what we call chronic complications. Then the chronic complications are also divided into two. The complications that affect the small blood vessels, we call them microvascular complications, and then there are those that affect the bigger blood or the big blood vessels. Those ones are called macrovascular complications. Now, the complications that affect the small blood vessels are also further divided into three. They are the ones that affect the eyes, then they're the ones that affect the kidneys, and then they're the ones that affect the nerves. So the condition we are looking at today, diabetes gastroparesis, is one of those complications that are chronic, affecting the small blood vessels, and in turn those blood vessels have an impact on the nerves. So when someone's nerves are affected, we all know what the purpose of nerves in our lives is. So nerves are what help us interact with the environment, how we feel, how we perceive things in the environment. So when nerves are affected, you either have an issue with movement, you might have an issue with feeling, or there is a group of nerves that operate internally in our body. Those group of nerves, we call that part of the nervous system, autonomic nervous system. So when that autonomic nervous system is affected in people with diabetes, they can present with this condition that affects the digestive system. So the reason that happens is that for people with diabetes, depending on how long they have had diabetes and depending on how well that diabetes is managed, diabetic people tend to accumulate complications, and the complications are worse for those people who have had diabetes for a long time, or in those who have not been managing their diabetes too well. Okay, so what is diabetes gastroparesis? It is also in some cases referred to as diabetes gastropathy. So you might come across those terms, diabetes gastroparesis or diabetes gastropathy. And simply put, it means that the muscles of the stomach is that bag that holds food immediately you swallow it. Those muscles are not working very well. And the reason they are not working very well is that the nerves that help the muscle to work and some of the cells that also help those muscles to work are not working. And the reason they're not working is because they have been affected by diabetes. When your blood sugar is high, because either you're not taking enough medication or the medication you're taking is not working, that high blood sugar affects how those nerves work. And once those nerves are affected, they in turn affect the muscles that form the stomach. So once that becomes an issue, it means when you eat and swallow food, that food is not going to move from the stomach into the intestines the way it's supposed to do. And usually what happens is that food is going to take longer. So the time it takes for food to move from the stomach into the intestines is prolonged. And this is not because there's an obstruction happening. No. It's because the muscles are not working very well. So that food essentially is not being pushed into the intestines from the stomach. Okay, so that in medical terms we call that delayed stomach or gastric emptying. You might hear me use the term gastric, stomach, they mean one and the same thing. Okay, so it's called delayed gastric or stomach emptying. Okay, and it has been found that in people with diabetes, there's some studies that have shown that more than 50% of people with diabetes have delayed gastric or delayed stomach emptying. But it is not everyone who has delayed gastric emptying who presents with symptoms of gastroparesis or gastropathy. Only about 5% of patients who have type 1 diabetes And 1% of patients who have type 2 diabetes present with symptoms of delayed gastric emptying. Okay, so we move on to the next section of our talk. The next section we're going to look at what is the relationship between blood glucose levels and this gastroparesis. And we have to look at this as a two-way traffic. What do I mean by that? It means that if your blood sugar is high, okay, especially if it is high over prolonged periods of time, this can cause one to have gastroparesis. Okay, and once you have gastroparesis, it's going to affect the control of your blood sugar, because food takes longer to move from the stomach into the intestines, and if it takes longer to move from the stomach into the intestines, it means it takes longer for that food, for the nutrients in the food to be absorbed, which definitely is going to affect your blood glucose levels. Okay, so when or how would you know, as a person living with diabetes, how would you know that you have a gastroparesis, or you have this, what you are calling diabetes gastropathy? Okay, so most of the times you're going to present with what we call digestive symptoms, and these symptoms are symptoms that occur because of many other conditions. So for starters, of course, you have to have diabetes. You have to have diabetes for a long time, and especially if you're not been managing your blood sugar very well. So what are these symptoms? Okay, so most of the symptoms involve feeling of being very full. Immediately you start, even before you finish your food, the food you're eating, you're already feeling full. Then you cannot finish the same food you used to finish previously with no difficulties. You cannot finish it. Then there's bloating. Some people get abdominal pain. Others get nausea. People get vomiting. You can also get heartburn, and you can also get lack of appetite. Okay. So once you get those symptoms and they become persistent, and you do not have any other reason why you would be getting those symptoms, it's time to visit your doctor, okay, or your diabetes management team. Stop. So when you visit your diabetes management team, that is your usual diabetes clinic or your general practitioner, the doctor who takes care of your diabetes, what are they going to do? They listen to your symptoms. They'll do an examination, just like any other time you visit the clinic or the hospital, and then they might decide to do a few tests. If they suspect that what you're having is diabetes gastroparesis, they will do several tests. And one of the tests that they usually start with is something called an upper GI endoscopy. Okay, most of you will know this one as you've heard someone is going for endoscopy or is going for something called an OGD. Now, the reason we want to start with that test is we want to make sure there is no other reason, and there is nothing happening in your tummy that is causing obstruction. Okay, so we want to rule out what we call structural obstructions, like let's say tumors in the stomach or tumors in the first part of the intestine. After that, once you make sure there's nothing happening there, and we also make sure that you're not taking any medication that can cause gastroparesis or cause similar symptoms. And some of these medications are some of the medications used to treat diabetes, like a drug we call metformin. Others are drugs that are used to treat other things, especially pain. Drugs to treat pain. They belong to a class called opioid analgesics. These are some of the drugs that we want to make sure you're not taking. Then once you're satisfied that maybe what you have is diabetes gastroparesis, we'll proceed and do what we call specific tests. Okay, and these tests include, we call them gastric emptying studies. So we want to know how fast are you emptying your stomach after you eat. And you'll be told some of these tests are imaging tests that work like a radiograph. Others are referred to as breath tests, and others are referred to as motility capsule tests. We'll not get into the details of that. The discussion of those tests is beyond the scope of our talk today, but those are some of the tests that can be requested. So once the doctor does those tests and they're satisfied, they confirm that you have diabetes gastroparesis, what next? The next thing is treatment. So treatment involves several things. One of them is your diet. So the doctor will discuss with you about dietary changes, or they can send you to a nutritionist or a dietitian to discuss dietary changes. And basically what you want to do is reduce your fat intake, also reduce the amount of fiber in your diet. We also advise people to take small, frequent meals so that they can be emptied a bit faster. And then, because sometimes when the disease is severe, or when that complication is severe, you might end up eating very little. So, and there's a risk of malnutrition. So what happens is that we might advise you on several different types of ways to supplement your diet. Then there are medications that we give, and these medications are basically drugs to stop you from getting nauseated or vomiting, drugs to also that hasten or quicken the emptying of your stomach. The other things that we can do is basically advise you on how we might stop some of the diabetes drugs you're taking, and then put you on insulin, because it's easier to manage diabetes for patients with diabetes gastroparasis. It's easier to manage the blood glucose with insulin as opposed to some of the oral medication that maybe you had been taking. So your doctor will also advise you on that. And of course, if there's any medication that you are taking that can contribute or worsen this situation, then we'll advise you to stop that medication. Okay. Then how does this diabetes gastroparasis affect your quality of life? Of course, when you're having abdominal discomfort, you're nauseated all the time, you're vomiting, most of the time, because these symptoms are quite bothersome, they will affect your activities of daily living. Okay. And then there's that risk we talked about previously of malnutrition because of not taking enough. And this condition has been known to interfere with blood glucose control. And if your blood glucose control is not optimal, what happens is that, of course, you'll end up getting more diabetes complications. So we know that the treatments you've talked to are not, they are not a cure, and they do not eliminate all the symptoms. So is there something along the pipeline system coming that, might give us better outcomes for patients who've been suffering from diabetes gastroparasis? And there's a lot of research going on, looking at what are the other causes of this condition. And once those other causes are established, and that will be a basis of coming up with newer treatments. Okay, but we cannot emphasize, or we cannot overemphasize that the underlying issue is poor control of blood glucose in patient diabetes. So it is better to prevent than to be looking for treatments when something has already happened. So we cannot overemphasize that for patients with diabetes, they need to tightly controlled or strictly control their blood glucose from as early as possible, so that we do not get this complication in the first place. Thank you. That is what we had for today. Until next time. Bye-bye.